Do you have any procedure or have you received any procedure in your body that we should know about? Medical important would be anything cardiac, anything
None.
with your kidneys. You've never had any important surgeries that we should know of?
No, nothing
No?
that is health concerning.
Okay, perfect. Did you have any sickness or disease, important diseases like hepatitis?
No.
Nothing in the past?
None.
Okay, so you're a healthy person. Perfect. Okay, do you have your wisdom teeth with you?
No, they removed it.
They were removed. Did you have braces?
No, never.
Never had braces. Okay. Do you have any sensitivity or anything we should know about inside your mouth right now that is bothering you?
When I brush my teeth, I am bleeding more than normal.
You
I'm bleeding.
have bleeding gums. Okay.
Bleeding gums. Yes.
That could be very normal. First, it can be hereditary, but it could be that you are brushing very hard, you're brushing with a very hard bristled toothbrush, or your technique is not correct.
Okay.
We're going to show you how you need to brush better in order to, not make your gums bleed. So I want you to be very, very comfortable. Nothing here is going to hurt. We do nice, soft, and sweet cleanings that are completely painless. Okay. Let's see. You're going to open really wide and you're going to show me your beautiful smile. Okay, very good. So what I'm looking for in here is that any new cavity has been formed and you don't know about, any fillings that you previously have are not broken. I am looking at very nice teeth. I want to see you smile. Can you bite for me? With your back teeth, with your molars. There you go. Don't open, please. And what am I looking for when I'm checking your mouth is, of course, I'm looking at your soft tissues. I'm checking your lips. I am checking your gums. I am checking your throat. Let me see, open wide. Say up. Perfect. I am checking the inside of your mouth, the cheeks, and I am checking underneath your tongue. I am looking for any stain, any different coloring of your skin, any lesion, anything that looks odd or off, which is very important, like I said before, in order to see if you have any sickness or disease inside your mouth. And I don't see any. Perfect. Okay, so what does this do? This eliminates stains, tartar. It whitens your teeth a little bit because, of course, we're eliminating coffee stains or red wine stains, like we said before. Okay. This makes the cleaning faster, and we can proceed with the whitening right afterwards in half the time if we weren't using this device or this instrument. Are you okay? Dame como un high five así. Perfect. So this is floss, and I want you to, I'm going to show you. Can I have a mirror? El espejo, por favor. So this is very important that patients learn that flossing is more important than brushing, okay? More important than brushing. What I want you to understand is that floss has to go inside your gum against one side of the one tooth and then on the other side of the other tooth, okay? This is the proper way to do it. Flosses for spaces where the toothbrush does not fit in, okay? And specifically the gum. When you clean your gum, see there's no blood. You have very healthy gums. Good for you. Sometimes we do have some swelling and we can see a little bit of blood, and that's just the way of the body calling our attention. Red alert. So what you do is you floss a little more and the blood is going to disappear eventually. Okay, so now we're going to brush. We're going to use a very soft plastic cup with a special toothpaste that has a little bit of pumice And what this does is it eliminates a little bit more of the surface stain that you can have. Open up a little bit. Okay. This toothpaste can only be found in a dental office, okay? So that's why it's so important to come and have your teeth checked and cleaned with a professional. Something that I want to point out is, Elsa, when the patient comes to receive any dental procedure, but starting with the cleaning. In the Dominican Republic, we don't have hygienists, okay? So the doctors, we're going to do the cleaning ourselves, which is something very important and different from the United States. Close a little bit. Okay, so now the next procedure is choosing a color. And this is a guide of the possible colors or tones that a patient can have. What we do is between the patient and myself, we decide what color is her, or what color are her teeth today closest to before doing the cleaning. After the cleaning, we take a look again and we check the color to see if there's any changes from darkest to lightest, okay? So dale un espejo a ella, por favor. We're gonna hand you a mirror. And, okay, so I want you to sit back and we're gonna turn off the light and we're gonna choose, okay, so I want you to smile first and we're gonna see here that you're not in the most yellow tones, yellower tones. You're very, very close to having pearly whites, but you're kind of around here. Let's lower the mirror a little bit so the friends on the camera can take a look. I would say that this is you. Can you open your mouth for me? Okay. If we look at it like that, do you think this is your color? This approaches your color?
Uh-huh. Got the other one.
Maybe the one next to it? This one?
Oh my God, this is good, guys.
Let's see. Yeah.
Uh-huh.
This is more you.
Uh-huh.
I would say so. So let's see on the bottom. Can you smile? Let's just check to see if the bottom ones open up a little bit more. I think the bottom ones are, yep, pretty close. Okay, so what we do is we take the number. This has a code here. It's B51, and this is what we're going to write down as your starting color. Okay, now, dame un poquito de vaselina. So now we're going to start separating the lips. We have to cover lips, protect cheeks, and gums. The whitening gel that we're going to use is very good for the teeth and it doesn't harm the teeth, but it can burn the skin. So it's very important that we protect properly everything around the teeth. First, we're going to use some Vaseline, just regular Vaseline on the lips. This is going to protect the lips from the burn if any accidents happen, like a little drop of the product, and it's going to keep the lips moisturized while we do the treatment. You can either push this a little bit further back or further to the front, and there is a plastic in between upper and lower teeth. That's a stopper for the tongue. So every time you want to swallow, I want you to touch that with your tongue. No saliva can come to the front, okay? Because then we wet the teeth. I want you to put your head back, please. And we're going to start protecting cheeks, inner cheeks, and lips. And we're going to proceed to cover the gums. Of course, this part is very important because we don't want any gel to fall on your gums. Bam. Okay, so what we do is we dry that material around the teeth and around the gums. And she's almost ready. I want you to keep on swallowing, okay?
Mm-hmm.
Yeah. And we proceed to paint on the teeth. This is going to stay for 20 minutes, and we're going to repeat it 3 times, okay? While we do this, the patient has to remember to swallow. She cannot have any saliva around the teeth because then this gets all diluted and it doesn't work as well. We're going to put this halogen light straight on your teeth. There you go. Are you comfortable? Mm-hmm. Perfect. So this machine has a beep, and every 20 minutes it's going to stop. We take the light away, we eliminate the material, and we start all over again. We're going to do that 3 times for 20 minutes. Okay? So now that we're done, I want you to take a look. We're going to eliminate the glasses right now. And after doing 3 sessions of 20 minutes each, we're going to go ahead and eliminate the product that has changed colors. We didn't say that before, but the material changes colors from very dark burgundy to bright green, and that's the way we know it's working. Do you feel okay? Mm-hmm. No sensitivity, no pain. Everything is okay. Perfect. And I like it. And we're going to compare. So we're going to compare the before. Let me see. Wait, don't take that off. Okay. This was you before. And now look at your teeth. You see the difference?
Oh my God.
So we went from not so bright white to whiter teeth. Okay.
This has been the best cleaning ever. For the first time, I always get, when I get my cleaning, they always kind of like, my gums get poking. I don't know, for some reason they hurt me some way or another, some doctors. But this is the first time, like I didn't feel any pain whatsoever, so.
Dental cleanings should not be painful.